Latest on the coronavirus numbers. 653 cases of COVID-19 overnight gets Mississippi closer to 28,000 total cases. The death count sits at 1,082. Now, government and health experts are warning Mississippi if people do not follow the Department of Health and CDC guidelines, recent spikes in COVID-19 cases could lead to stay-at-home orders returning. 12 News' Alex Love sat in on the very serious briefing today, and he is live in the newsroom with what the state faces. Alex?
Melanie, we have seen 3 straight days of over 650 coronavirus infections coming in daily and hospitalizations at an all-time high. This wave could overflow into the ICU, where ventilators and space is running low.
My friends, this is not a hoax. It is a danger.
In his first briefing in a number of days, Governor Tate Reeves and Dr. Thomas Dobbs sounded the alarm with rising trends of COVID-19 in hospitals.
A lot of the big hospitals have 0 ICU beds available on a regular basis. So it's a real challenge, and it wouldn't take a whole lot of COVID patients to overwhelm the system. You know, we've had reports of people having to spend overnight in the ER or to replace ICU capacity.
On top of non-COVID patients, those hospitalized by the virus as of July 1st total 579. Meanwhile, ICU stats stayed at a flat rate between 150 and 160, but soon the rise in patients could overflow ICU and ventilator capacity if conditions worsen.
Having a higher number of those individuals in hospital beds is a leading indicator that it is very possible that the number of ICU beds that will be needed will be higher than where we are today.
Experts say the system can be saved if people just think about those vulnerable around them. Since the start of the summer, the highest increase of state cases are those 18 to 29, exceeding 5,600 infections.
If you will just do the little things, wear a mask, avoid large crowds, please do not throw needless parties. We can regain control.
If you're a young person and you're not worried about dying, but you're going out, you're keeping somebody from visiting their grandmother in the nursing home. Me not wearing a mask if I'm asymptomatic transmitting, it's not about me, it's about everybody.
In the case Mississippi hospitals do reach capacity, state leaders laid out options to move recovering patients to Camp Shelby or 21 other rural hospitals contracted with the state.
And Mississippi's recent hike is also being noticed around the nation, with New York and New Jersey adding Mississippi to the list of visitors who must immediately quarantine for 2 weeks if they visit there.